Good morning, how are you all? Hope you're all well. A cardiologist friend of mine sent me a paper recently, which I thought I'll discuss with you very quickly today. It basically, the premise of this paper, and I'll put it in the notes so you can read it for yourself if you like. But the idea behind this piece of research is that there is an increasing body of work which suggests that members of the LGBTQIA plus community have a tendency to experience cardiovascular issues at a higher rate or at a more serious rate as well than the members of the heterosexual community. And what this paper really calls calls for really is just essentially more research to bridge the gap, but also to understand why this could be. Now, one of the things that's suggested is that basically members of the LGBTQI plus community have more stresses across their lifespan due to discrimination, violence, and all sorts of other stuff. And this, in effect, affects their cardiovascular health as well. So as I say, you can read the details in the paper, but I just thought it was quite interesting from us as therapists or mental health professionals. Why would this be of interest? Well, it's partly something that we can help with, because if we can help members of the community learn techniques where they can potentially learn more mindfulness, or basically they can control stress and anxiety in a more successful way, then potentially it will also help their cardiovascular health. Now, another thing to note is that I am aware of various trans individuals which, in various countries, which haven't been able to pursue their transition through, say, more conventional medical route, and therefore sometimes they have to use the black market to obtain what they need. And again, there's inherent risk with that, and to what extent that again affects their cardiovascular health. But from us as mental health professionals, really, it's all about trying to help the community deal with the stress and anxiety it faces at various times. I think at the best of times, there's an element of that. Obviously, in the times we live in, there's double, triple, 100 times that, just because the way the world, the direction the world is going, and the toxic narrative that they have to deal with on a daily basis. And I think this is important. I don't think we can proclaim that we can remove the stress and anxiety from the community. I don't think, us as allies, of course, we can contribute to alleviating that to a certain extent. But at the moment, we can't just say, okay, just don't be stressed. That's not the point I'm making. The point I'm making is that if we can help as professionals to reduce the impact of stress and anxiety, or to make the attacks of panic and so on less frequent, I think we're already helping their cardiovascular health as well. So, excuse me a second. That was pleasant, talking about health. So I think the point of this paper really isn't to suggest that the LGBTQI plus community suffers from more cardiovascular diseases necessarily, but what it suggests is there has a tendency to, and the whole cardiovascular system is at risk because of external pressures as well. And of course, one of the things that the paper calls to is more research, and especially longitudinal research, meaning same individual across a number of years, to identify some of these features. So I think ultimately, like anything, most things are, like most things in life, I should say, most things are linked. Your mental health and your physical health are, there's an undeniable connection there, which we know of, and the other way around. And the way we govern and deal with emotions, the way we process what's happening to us, especially for a lot of external factors, will potentially affect our body. The way we internalize the world and the toxicity around it, it will potentially, affect our health as well. So it's an interesting paper. As I said, if you can read it, I think the main message today is we cannot suggest that just dealing with mental health issues will automatically solve everything, but at the same time, we cannot deny that everything is interlinked, and the more we look after our general health, mental as otherwise, the kind of sort of happier individuals will be, or happier, maybe a wrong sort of term, maybe more content. So yeah, I hope that's an interesting point for you to ponder on, and have a good rest of the week.